Hello. This message is directed at everybody that deals with doctors, including doctors and nurses and their assistants. Hurting patients because you're trying to save money or some other bogus reason should not happen. Now, I understand that there are potentially procedures where it is difficult to prevent the cause of pain, such as giving birth. And I also understand that epidurals have a certain degree of risk. If the injection is not done properly, there might be lifelong consequences. So, honestly, I don't think epidurals should be used. But I do not know how many women end up with lifelong problems because of an epidural. When you're working with people, especially when they're young, if you cause them pain that is above a minor level, you are traumatizing those people. You are causing them, in many cases, to want to never ever go to a doctor again if they can possibly avoid it. And many times, by the time they do go to a doctor, it will be too late because they were too scared when it would have been possible to reverse the course of the disease or at least halt it. If the Hippocratic means something to doctors, then doctors should be doing whatever they can to ensure that they are inflicting minimal amounts of pain. And when they do inflict pain, they should be like Dr. Pimple Popper, Dr. Sandra, I think it's Lee, was very sympathetic and patient and compassionate. You should never do what has happened to my kids and my wife, where you are remonstrating the patient because they are expressing how much it hurts by crying or screaming. Now, maybe you feel guilty because you hear it and you don't know how to deal with it. And maybe it's happened so many times that you're frustrated because you seem to be unable to resolve the problem so that you're not hurting more patients. But let's be frank here. If you are in a medical office where you have gone to the administration and said, look, I understand you're trying to save money. However, we are, because of your policies, financial policies, for example, we are causing trauma to patients, including to children. This needs to stop because traumatizing people means they are less likely to go back to the doctor. Now, from a purely financial point of view, that's bad for business because patients who don't come back don't pay again. Also, patients may die because they're so afraid of having pain inflicted on them again that they won't go back at all, or only when it's too late. And maybe your administration says, oh, you know what? You're right. That makes a lot of sense. Financially and compassionately, we should be doing better. So what can we do to reduce the amount or eliminate the pain that our patients are experiencing? And you guys figure out a plan. But what if they don't care? And I know there are facilities where they don't. I know there are facilities where the only thing they care about is money, which is disgusting. No facility that deals in medicine should say that the patient's needs are less important than the profits of the company. Now, I'm saying profits, not income. So if you find yourself in a situation where they will not be reasonable about protecting the patients that you deal with and everybody else from trauma, you need to move on. I don't know, start your own clinic or find a better clinic where they actually care about the patients. Because you are causing harm that has a snowball effect over time. Because, I know people who are sick and they need help and they're scared of going to the doctor. My wife died of hypoglycemia and stage 4 cancer, partially because she refused to go to a doctor about it for 7 years approximately. At least according to my estimate on when she first had some concerning symptoms. So I'm going to tell you a story. It's an anecdote from my family's life. In my family, when you hit puberty, there are certain medical conditions that crop up. And one of them is ingrown toenails, primarily the big toes. I've had the ingrown toenails permanently resolved on both of my big toes by doing matrixectomies, because the temporary solution of just clipping off part of the nail to get rid of that spur that's digging into your flesh does not work. It doesn't work. And believe me, before it went to the point of that, I was working on it on my own. Yeah, it got red, it got pussy, and I was digging to try to get the spur out, which I couldn't do, and I was trying to get the pus out so that it wouldn't get infected worse. And I did that, and eventually my parents realized what was going on, and then they took me to this podiatrist. And this putz, he was an older guy. I'm sure he's been dead a long time now. He was going to work on my toe. So what does he do? He hands this sprayer that has this cold liquid in it. I don't know what the name was. It was a chrome-looking, giant kind of syringe-type looking thing. And he said, she's going to spray on your toe, and I'm going to do blah, blah, blah. I don't know what it was that he was doing. I don't remember anymore. And here's the reason why. Because she was a bad aim. She was not hitting the mark very often, and whatever it was he was doing was causing me a large amount of pain. And I was screaming so loudly that everybody in the lobby could hear it. And my sister had to go next, so she was terrified. We didn't ever go back to that podiatrist again. And that is one of my earliest memories of trauma being inflicted on me by doctors. Now, you have to understand, I'm nearly 58 years old. Medicine has supposedly advanced tremendously. Apparently not in America, because here's the thing. After that experience, my dad took me to a doctor who did the work in the operating room, and it was fine. It didn't hurt. It didn't cause any more trauma. I remember vaguely what he looks like even. I remember the first guy much better. But the second doctor, he didn't inflict trauma on me, but he was not entirely successful in helping me with my plantar's warts and with my ingrown toenails. So I still had ingrown toenails on both of my big toes. So we went to another doctor that he apparently knew personally. Now, I have to go backwards a little bit here before I tell you about that doctor, because years before that, my parents had some kind of a concern about me medically. Um, I don't know what it was. They never really told me. Um, but I remember going to a hospital every so often, and they would draw blood. And the first few times I cried. And then my mom said, well, if you don't cry, I'll get you a treat. So eventually I learned how to not cry on receiving that small amount of pain. And honestly, I don't even remember if it was a trivial amount of pain or if the person drawing my blood was rough or anything like that. I don't remember. All I can tell you is this. I had gotten to the point where I didn't cry, I didn't tear up, nothing. And I got my treat. And that was the deal. So I think my mom was usually the one who had to take me to the doctor, because in those days the wife stayed home and my dad was a teacher. The doctor, for some reason, decided that they needed my bone marrow. I don't know why. If you've never done bone marrow extraction, it is exceedingly painful. And they told me so. They said, we're going to numb your butt because we need to take some bone marrow out, but it'll help with the needle going into your flesh, but not help with your bone. And they had me lie down with my pants down, and they gave me a towel, I think it was. And I said, what's this for? They said, put it in your mouth and bite down on it. And I said, why? So you don't shatter your teeth. Wow. At that point, I knew I was in trouble. I mean, can you imagine pain so bad that you might shatter your teeth if you don't have a towel to chew on? So, yeah, I chewed the heck out of that towel because it was excruciatingly painful. Why they didn't give me laughing gas, which I've had in the past for like when I went to the dentist, I don't know. Apparently, they didn't think it was important to not traumatize a child. But they did traumatize me. In fact, it wasn't until I was in my 40s. Now, keep in mind, I was probably about 10 years old, maybe, when this happened. After 2 vials of bone marrow were pulled out, then my mom felt so bad, she took me to get an ice cream sandwich, and then she took me to Big Boy to get a meal. And she probably shouldn't have given me the ice cream sandwich, because as we were sitting there waiting for our order, I suddenly vomited all over my plate. They in those days, they would put an empty plate at the table ahead of time. Yeah, I remember filling up the plate with vomit, which was, the ice cream sandwich. And, that's totally understandable. You eat right after a traumatic experience, you're quite possibly going to vomit. And I don't remember anything after that. I don't remember if we ate or if we left or what happened, but it was horrible. It took me into I remember almost a decade later going to the doctor's office with my dad, and they were trying to, I don't know if they're trying to draw blood or put an IV in. I think it was draw blood. So the lady tried in this elbow, and my dad and the nurse were making me laugh because they knew of course, my dad would know that I had been traumatized. And so I was laughing, and she missed. That made me not happy. And then they tried my wrist. So I was half laughing, half crying, and she missed again. Finally, she went for that one, my left one. And by that time I was just crying. That's one of the worst experiences I've ever had with somebody trying to get a needle in me. I don't even know why it happened, other than maybe she was incompetent. But yeah, it took me into my 20s before I could handle an injection without crying, nausea, dizziness, faintness, tingling in the extremities from my blood pressure going crazy. And it took, I don't remember exactly when I stopped having a problem with blood draws, but I remember for many years after that experience with 3 attempts on my veins or arteries, that every time I had to go in to have a blood draw, I was scared. And I would tell them I had a phobia of needles and to please use a butterfly needle, which is a very small gauge needle because it's less painful. It was mostly the problem really wasn't the pain of the prick of the needle. The problem was the trauma from withdrawing that bone marrow from my pelvic bone. So psychologically, I was having a problem, not physically. Because I'd already been able to stop reacting to these things, but now I couldn't. So I'd go in there, and they'd do it, and I would feel nausea and dizziness and faintness and tingling in my extremities, and they would say, "Do you need a snack? Do you need a drink?" And I was like, "Yes, yes." So they would give me those things. I'd consume them, and I would wait a few minutes, and then I would be okay. And some of them were excellent at it. Some of them I barely felt it. Even now, I mean, I've worked with phlebotomists, so to speak, worked as the patient, where I barely felt anything at all. So there are some out there that are just amazing. But this went on and on and on and on into probably my late 30s, I guess, before I was able to suppress that psychological reaction caused by the trauma when I was in grade school. Yeah, so that was great, right? Weehaw! Lots of fun. Now, the only thing, that keeps me going back to the doctor is I understand that the pain is temporary and the solutions should be, when possible, permanent. Whereas other people can't move past the trauma. So, getting back to the story, the original story, not the segue. So we went to the doctor's office. There was the doctor who's my dad's friend, and we had explained to him that I had been traumatized and I was phobic, and so the doctor gave me some kind of a sedative to a pill, so that I would relax. And then he took one of those the surgical tool tray that you usually see in operating rooms and stuff, and he took it and turned it like this so I could not see my feet. And he proceeded to, with virtually no pain whatsoever, he proceeded to numb up my toe. And then he thought it would be clever of him to show me just how numbed up I was. I think he was doing this to try to allay my fears. So what he did was he said, I'm going to put the tray back down now so you can see that you're numb. And he did. And there was a syringe sticking in my toe. That freaked me out. My blood pressure would boing, because there was no pain at all, but it was the psychological trauma. So he had done everything right up until that point. He could have very easily done something not involving the syringe to prove to me that I was numbed. So he re-traumatized me. Best of intentions, but bad plan. Right. So again, in my 20s, I could handle injections. In my late 30s to early 40s, I could handle blood draws. It took that long to get over the trauma, which should never have happened in the first place. Because as a young boy, I'd already learned not to be affected by it. And I'm not particularly interested in some kind of a lame duck excuse on behalf of the doctors. Oh, well, they have only limited resources, or there's only so much you can. No. You don't traumatize children. Never should you do that. So when my wife was dying of cancer and needed a blood transfusion, I took what I felt was the final step in my process of getting rid of my fourth phobia, because I had 3 other phobias I'd already gotten rid of by that point. And I donated my blood for my wife because we had the same blood type. And I'm so glad I did not look when he was putting the needle into my arm, because after he had got it, and he did a great job. He did a great job. And then I looked at it, and it's a fairly substantial looking needle. And I said, oh, I'm so glad I didn't look while you did put that in there. But he did a great job. I didn't freak out or anything. And we had a nice conversation. And that's actually important. If you're a phlebotomist, you must learn to have a good, positive, distracting conversation with your patient. If you can't do that, especially when you've got a nervous patient, it's going to be bad. Well, apparently I'm not 100% over that phobia. Almost 58, remember. It's still there because last year, I think it was last year, my daughter and I went to Hawksworth to donate blood together. She does it in honor of her mom, who died. And I do it because of my wife, and I also do it because it's the right thing to do. So we went, and my daughter went over there, and suddenly she comes back while I'm still waiting, and she said that they had tried to get it in there, but they couldn't get it in, and they had wiggled it around, and it had hurt, and she couldn't donate blood. And anytime that we've gone to Hawksworth and they have rejected her for whatever reason, it really upsets her, because she really, really, really wants to do that. Like, we would go having when she had attained the minimum weight that was required for a minor of her age. And then suddenly we'd get there and they'd be like, oh, well, you're not the right weight. And she said, well, that's the weight I was told last time. Well, it's not the right. They would reject her. And this happened over and over and over. So I was like, okay, well, I'm going to give blood and then we'll go. And so my daughter and I went over there. I sat down, and the lady, the same woman who had tried on and failed on my daughter, tried and failed on me. So then she's wiggling it around, and that started to trigger a psychological reaction. I became uncomfortable. And then the second that, a second phlebotomist came over, a more senior one, and she's wiggling it around. They didn't bother to take it out and put it back in. She's just, I mean, not obviously not like this, but she's moving it around and in and out and trying to find it. Well, my daughter and I had large bruises in those areas. They failed with both of us one day. 2 failures. I never will go back to Hawksworth again because we had so many problems with Hawksworth. So yeah, unfortunately, not 100% gone. But, I'm still going to try again to do a donation of blood. It's just a little bit hard because of all the medications I'm on. Anyways, the point here doesn't even stop here. You would think decades later that things in America, medically speaking, would be better. No, that is not the case. Doctors, including dentists, are still traumatizing their patients as children. Yeah. Did you know that there are actually doctors' offices that specialize in helping traumatized children? They're extra kind and gentle. I've had to take my son to them. I've had to take my daughter to them. They're very nice. And with their help, my children have gotten over their fear of needles. I mean, when my son and I got vaccines last weekend, he used to be when he was a little kid, he would sit on my lap facing me, and I would hold the arm that was going to be injected so that he couldn't wiggle it, because I had explained to him, if you take a piece of paper and you take the syringe and you jerk the paper, it gets torn, right? And the same thing will happen with skin, basically. It just will be very painful because you're ripping through flesh. So he knew that. And so I would hold him and he would get these injections, and then, eventually he was able to overcome his phobia. And so when we did the vaccinations last weekend, he did great. He didn't have to sit on my lap. He didn't have to have me hold his hand or anything. I was very proud. But in 2018, when my daughter's ingrown toenails came in, took her to a doctor, Dr. Dye, West Allis, Wisconsin. Yes, I'm naming his name. And I'll tell you why. Not only did he traumatize her by injecting a large amount of what presumably was lidocaine into her toe, when she started crying, he told her to be quiet, that it would scare people. Really? That's the kind of doctor we don't need. I don't care if he knows his job. If he doesn't know how to, number one, not hurt patients, and number two, how to be compassionate, that person should not be a doctor. I felt so bad. So I took her to a different doctor. We agreed to do it in a special office somewhere, and went there. And instead of sitting with my friend who had driven us and whom I hadn't seen in decades, instead I went to sit with my daughter and hold her hand, and because she was very scared. And that went much better. Unfortunately, with my son, when his ingrown toenail started, we went to a doctor at the same office of the Dr. Fry of Cincinnati Foot and Ankle. He had helped me get insoles. And then when the insoles, they could never make the insoles fit me correctly, suddenly he was like, can't help you anymore. I was like, well, can I see a different doctor in your office? Nope, you got to go find a different doctor entirely. So we went there for my son, saw a different doctor named Dr. Deepika. And her assistant injected this massive amount of anesthetic, which I assume was lidocaine, because that lidocaine is very fast acting, into my son's toe, and it was excruciatingly painful for him. And if you'd seen my son's toe, it changed colors, becoming yellowish because of the huge amount of fluid being pumped in. It was like a 9 on 10 scale. And that was horrible for him. And so when they were done, and they only did like snipping off part of the toenail, like at an angle to try and get the spur instead of actually going down to the roots and getting the roots out. So we scheduled for the next time on his other toe to do it in an operating room so he could be put under. And unfortunately, he had to go to the hospital right before that happened. And so we rescheduled, and he had to go to the hospital right before that happened as well. So ultimately, after that, they would not return my phone calls. They wouldn't even say, sorry, we can't help you because your son keeps on ending up at the hospital right before he's supposed to have surgery. They just didn't return my calls. So I'll never go back to Cincinnati foot and ankle, ever. Because that's two times that for financial reasons only, they dropped us like a hot potato and did not communicate compassionately or at all with us about it. Or with me, I should say. So I took him to a different doctor. And she was able to do it slightly less painfully than the first, than Dr. Deepika's assistant. And then it failed. Went back. That doctor had moved on to a new location. She was like doing an internship at this office, and she went to another office. So there was another doctor interning, and she was much better than the previous two. Unfortunately, on one of the toes, the ingrown toenail came back. And she had moved on after her internship. So I was like, good Lord, we get comfortable with a doctor, and that doctor moves on. I don't want to go back there. And the doctor whose office it was, he was so busy, it was just going to take too long to see him. So I was like, okay, got to find a different podiatrist. So I took him to another podiatrist. Very nice guy, very, very intelligent and humorous older fella. And smart, except for the fact that he also used lidocaine. I mean, they all apparently are using lidocaine because every time that my son's toe was ballooning up with large amounts of liquid to the point of discoloration in the direction of yellow, just irritates the piss out of me. And this was the first time I didn't have to hold my son's hand. He just sucked it up, I guess. But this doctor wasn't mean, maybe because I was in the room. I'm not really sure. And so he took care of my son's toe, and it came back. We went back, and he cleaned it up. And it came back. Now, I'm a little bit uncertain how many times we had to go back. But there was at least one more time, if not two, that we had to go back. And finally, he did the correct procedure. Now, when I say correct procedure, when you do a matrixectomy, there's the lazy way to do it, which is what these doctors have been doing, and then there's the correct way to do it. The lazy way is where you extract the nail with the roots, but there is no guarantee that all the roots will come out because they're not cutting open the flesh to make sure they get it all. And that was why his toenail kept on growing back in that region and kept on growing back with ingrown toenails. Yeah. So finally, this past time, I said, look, we've been to all these different doctors. This is the third time, maybe, I guess, coming back to you. This is enough. Please get it done right. So this time, which was like 2 weeks ago, I think, he actually did the correct procedure, the procedure that had been done on me. So what they do is they numb you up, and then they cut along the toe nail down into the matrix and the flesh. So they're actually cutting into the flesh below the cuticle of your nail, and then they get the whole thing out because they can actually see to make sure they get all the roots. That's called a matrixectomy. Now, I don't know what the name of the matrixectomy they do that is a lazy way of doing it that causes recurrence. What that one's called, I don't know, but I'm going to try to find out. Sorry. But if you have to take your child to having grown toenails removed, tell them you want them to do it the right way, the full way, where they're actually cutting into the flesh of your child. Because I guarantee you, taking your child 3, 4, 5, 6, 7, 8, 9, 10, 11 times because they're being lazy, or maybe for extra profits, is not good for your kids. Okay? Now, doctors, in podiatrists in particular, I'm really pissed off at you. You are supposed to be humane and compassionate and do the best you can to help your patients. And yet, many of you, dentists especially, are traumatizing your patients. Now, I don't know what your excuse is, and I really don't care. If you don't know how not to do it without inflicting pain on your patients, don't be a doctor. Go flip burgers. Because the burgers aren't going to care that you're burning them. Don't be a doctor if you cannot be compassionate. Because I've heard too many times where a doctor said to my wife or to my child, you need to stop crying. You're scaring people. That is totally unacceptable. That happened in Indonesia. It happened in America. Never, ever, ever say that to a patient, because that is so insensitive, and it just contributes to not only the trauma but the distrust of doctors. We have an epidemic of people in this country who don't want to go to the doctors because they've been traumatized and sometimes, like in the examples I've given, treated poorly verbally. If you cannot do it compassionately, get out of the profession entirely, or go be a researcher where you're not interacting with humans in a medical manner. Because if you don't, that means you're a sadist. You're a fucking sadist. And you disgust me. Should never have been given your license. And while I'm on the topic, all you administrators and managers who are always, the money's the most important thing. I'm sorry. No, it's not. Medicine is for people. We are not machines, and we do not deserve to be treated that way. Tell me, with your $1 million a year or whatever it is, when you go to a doctor, would you accept it if your doctor hurt you? No, right? So why is it acceptable for you to allow your doctors to hurt the rest of us? It's not. Stop inflicting pain on us so you can have money for yourself in excess of a reasonable amount. You also should not be involved in medicine if you are promoting a situation that traumatizes people, especially children. I hope I have made myself clear, and I hope that someday the government gets its heads out of their collective butts and stop stuffing money from their sponsors and their patrons up their butts so that they can actually see the damage they're doing to this country. This country is being destroyed by greed and by fanaticism. Stop hurting our children. Hi. Thank you for watching my video. And I hate doing this, but things have gotten pretty sketchy with my employer. And without going into all the details, which I have covered at other times, at least in part, I need some financial assistance. If you have the opportunity to do so, that's great. If you don't, even if you can just put in a word of support in the comments, that helps. To have even just that is good. But financially, I need to be able to carry on doing what I'm doing with these channels. Not so much this channel, not so much the Eclectician channel, which is mostly just me learning about stuff and sharing it with you, but with my Glenn's Fast Reviews channel, where most of what you see that I review, I've purchased myself, or I've gotten at a food pantry, or somebody gave to me because they know I do reviews. But I have invested huge amounts of money in it. And at this point, with a little over 1,800 viewers, I'm earning maybe $125 a month, which doesn't cover the cost of what I've done, let alone the ongoing cost. And then even worse than that is my third channel that's the PC Expert Amateur, which I've invested a large sum of money that I should have been saving for my retirement, because I wanted to be able to present a lot of information about fans and air coolers and water coolers for computers and other things as well. And in order to do that, I had two choices. I either had to make deals with manufacturers and sell my soul, or stick to my ethics and pay for things myself in order to not be beholden to somebody and not feel like, oh, I owe them. So yeah, it's pretty costly. And with the situation with my employer, Amazon, in which the workers' compensation company Sedgwick refuses to fix my shoulder, which was injured at work over a period of months last year because Amazon's management refused to abide by their own policies to provide me support. I may end up having to pay for the surgery myself with the help of my insurance, and that will still be very expensive. And then I would be out of work for at least a month. So switching to another job, it would be hard, because if I come to you and I say, hey, I want to work for you, and you're like really interested in me, and then I say, oh, by the way, in the near future, I'm going to be having a shoulder replacement, so I will probably be out of work for a month. You're probably going to say, I'll pass, thanks, though. Which would actually be illegal, and you won't tell me that's why you're not choosing me. But, you know, it is a problem, especially with me being as old as I am. I'm almost 58. So if you could please, if you can either go to the my YouTube channel, Glenn's Fast Reviews, and you can make any kind of a donation on there, any size, any time you want, through that, because that's my monetized channel. Or you can go to patreon.com. That's patreon.com/Glenn MII. That's GLENNMII. And you can make a recurring donation. The smallest one I have on there right now is $10. If that's too big for you to give on a monthly basis, let me know. I can always add a smaller one than that. You know, I just need to know. But again, if you are financially strapped, please don't send me money. I don't want somebody else getting into trouble financially just to help me. That would weigh very heavily on my conscience. So thanks again for watching this video, and let's make the world a better place.